First of all, let's look at the instruments involved in the removal of artificial calculus. So the first thing that we need is the examination set that comprises of mouth mirror and the periodontal probe, as well as the Explorer 1723. I will explain each function of this instrument. Okay. Mouth mirror basically aid in visualizations and also help us to retract the cheek, lip, and tongue during our instrumentations. Next, this is a William periodontal probe. It comes with a measurements at the end to help us to measure the probing pocket depth as well as the recessions in the patient oral cavity. So we use this periodontal probe to do our baseline periodontal measurements to have our periodontal charting. This periodontal charting is very important because it helps us to achieve to our diagnosis and also enable us to determine the site for instrumentations. Next, this is an Explorer 1723, which we use to detect the calculus. We can use this to detect the calculus prior to the instrumentations and also after your instrumentation, so that we can determine whether you have removed all the calculus subgingivally especially. So now let's look at the scaling instruments. Okay. Before we move on to each of the scaling instruments that we use, let's look at the three main parts of a instrument. Okay. So this is a handle of the instruments for us to hold or grasp the instruments. And this is a shank of the instruments. Okay. This is called a functional shank. And the one near to the working end is the terminal shank. Okay. And this is the working end. Right. Okay. This is a sickle scaler used for supragingival calculus removal. And this sickle scaler have a flat surface and two cutting edges that converge in a sharp pointy tip here. Okay. So we have anterior sickle as well as a posterior sickle. This is an anterior sickle, whereas this one is a posterior sickle. Posterior sickle is used to remove the supragingival calculus at the posterior region, as the name suggests. So what is the difference between the anterior and posterior sickle? The main difference is actually the terminal shank, which is angulated for the posterior sickle, whereas for the anterior sickle, it has a strict shank over the terminal area. Okay. So for the subgingival calculus remover, we are supposed to use the Gracie's curette to remove the calculus beneath the gingival margin. Okay. These three are all Gracie's curette. Okay. Gracie's curette basically are site-specific curettes. We have different numbers cater for different tooth surface and areas. So for 5 and 6, it's used for anterior and premolars. And this is a 11, 12 for the mesial surface of posterior teeth. And this is a 13, 14 for the distal surface of the posterior teeth. Let's just look at the difference between a Gracie's curette and a sickle scaler. If you can observe from here, we can notice that this Gracie's curette do not have a sharp pointy tip as like the sickle scaler. Now I will show you how to identify the correct cutting edge of a Gracie curette. This is a Gracie curette number 5 and 6. In order to identify the correct cutting edge, we need to hold the instruments perpendicular to the floor and make sure the terminal shank is perpendicular to the floor. Once the terminal shank is perpendicular to the floor, what you can observe that the face of the curette is here. And the one that's landing towards the floor will be the correct cutting edge, which is this side. So this is the correct cutting edge of this curette 5 and 6. And this is the only working cutting edge that can use to remove the subgingival calculus. Whereby the other edge is not the correct cutting edge. And we cannot use this to remove the subgingival calculus effectively. Let me show you how to identify the cutting edge with another Gracie curette. This is a Gracie curette number 1314. As I mentioned just now, you need to hold the instruments where the terminal shank is parallel to the floor. This is the terminal shank of this 1314. Once the terminal shank is perpendicular to the floor, you can observe that the cutting edge is the side that actually slanting towards the floor, which is this side. You can see that this face is actually slanting towards the floor. And this will be the correct cutting edge for this Gracie's number 1314. First, I will show you how to remove supragingival calculus from the anterior teeth. So, we need to identify the correct instruments. So, this is a sickle, anterior sickle scaler used to remove supragingival calculus from the anterior teeth. We need to hold the instruments with a modified pen grasp, whereby you use your index finger and your thumb to hold the instruments, and the third finger act as the fulcrum on the instruments, and the fourth finger will be used as the stable finger rest, so that you can stabilize your instruments during your supragingival calculus removal. So let's look at how to remove the supragingival calculus from the incisor. First of all, you need to adapt your cutting end onto the tooth surfaces, the area that you want to remove the calculus. If you can see, there is abundance of supragingival calculus on this incisor. So, adapt the working end onto the tooth surface, engage the calculus, and then use a vertical pull stroke to remove the calculus. Okay. When you remove, make sure the cutting end adapt well along to the tooth surface. Okay. Here, I'm removing the calculus from the mid-buccal towards the distal of the incisor. Start from the mid-buccal, engage the calculus, and then make a vertical pull stroke to remove the calculus. Now, we have removed the distal calculus. Let's remove the mesial side of the calculus. So you need to change the direction of your sickle scaler and point your working tip towards the mesial. Right? So you adapt your working end to the mid-buccal of the incisor, engage the calculus, and use a short vertical stroke to remove the calculus along the mesial. Okay, now you can see that all the supragingival calculus has been removed. Now we want to remove the supragingival calculus on the posterior teeth. So first, we need to choose a correct sickle scaler. This is a posterior sickle scaler. Hold the instruments with modified pen grasp, and then have your finger rest, fourth finger as your finger rest, to stabilize your position in the oral cavity so that you can move the instruments with a stable motion without injuring the patients and yourself. Same thing, we need to adapt the instruments onto the tooth surface. Let's see this posterior sickle. If you can see, the cutting edge is actually adapting on the tooth surface. So once you adapt to the tooth surface, same as the anterior, you can use a vertical short pull motion to remove the supragingival calculus. If you can observe, when you insert the instrument, the terminal shank here is actually parallel to the long axis of the molar. If you use the other end of this sickle, posterior sickle curette, you will find that you are not able to adapt the sickle, the cutting edge, onto the tooth surface. It seems that it do not hug on the tooth surface, and the cutting edge is actually facing out towards the gingival. So this is a wrong side of the working end. You need to turn and use the other side, which it can adapt and hug the tooth nicely. If you can observe from here, this instrument can be inserted and hug the tooth nicely at 0 degree like this. And the terminal shank is parallel to the long axis of the tooth. So use the vertical movement, continue to remove all the supragingival calculus. For the palatal aspect, we will be applying the same principle for instrumentations. So now we would like to remove the supragingival calculus from the canine. So same thing, we use the anterior sickle for the anterior teeth. Hold the instruments with modified pen grafts with your forefinger as the finger rest. Adapt the cutting edge on the tooth surface and start the removal from the mid-palatal up to the mesial of this canine. When you want to remove the distal, change the directions of the cutting edge to the distal. Adapt your working end, the cutting end, onto the tooth surface. Engage the supragingival calculus. Use a vertical stroke to remove all the supragingival calculus along the distal surfaces. Now, you can see all the supragingival calculus has been removed from the supragingival area of the canine. Now I will show you how to remove the supragingival calculus from the palatal aspect of the posterior teeth. So for this posterior region, we will use the posterior sickle to remove the supragingival calculus. Same thing, we need to hold the instrument with modified pen grafts and also with your forefinger as your finger rest as near to your working tooth as possible. Now you need to adapt and insert the instruments to make sure that the cutting end is always adapt onto the tooth surface, like this. Once you adapt to the tooth surface, you found that you are able to engage the supragingival calculus and remove it with a short vertical stroke. Repeat the movement until you are able to remove all the supragingival calculus along these surfaces. Apart from the vertical stroke that we are using just now, we can also apply a horizontal stroke to remove the supragingival calculus. But one thing to make sure is that the sharp cutting edge is always adapt well onto the tooth surface. And to make sure you apply the cutting edge further from the gingival margin, because it is very sharp and it may traumatize the gingival tissues. I will show you how to use the instrument in a horizontal stroke. Engage the calculus and remove it with your horizontal stroke. Now, I will show you how to remove the subgingival calculus from the anterior tooth. First of all, we need to choose the correct Gracie's curette to be used. Now, I will show you how to remove subgingival calculus from the anterior regions. So for anterior region, we will be using Gracie's 5-6 to remove the subgingival calculus. After we identify the cutting edge, we need to insert the instrument in without traumatizing the gums. So always make sure your cutting edge adapting on your tooth surface, but not facing towards the gums. First of all, we need to insert the instruments at the 0 degree, whereby the end of the working end is always adapt and hugging onto the tooth surface. Insert your instruments nicely into the subgingival area. Once you're able to insert the instruments, you will now open up the cutting edge, in which the terminal shank now, if you can observe now, is actually parallel to the long axis of the anterior incisor. After you engage and activate the instruments, you will now use a vertical pull stroke to remove the subgingival calculus, like this. Okay. So if you want to continue with your movement, insert again with your 0 degree motion. Open up your cutting edge at 60 to 70 degree. Make sure the terminal shank is parallel to your incisor. Use a vertical stroke to remove the subgingival calculus. Continue until you're able to remove all the subgingival calculus. So if we want to remove the palatal subgingival calculus for the anterior tooth, same principle applies, whereby we'll use same 5-6 Gracie curettes to remove the subgingival calculus. Hold the instruments with modified pen grabs with your forefinger as your stable finger rest. Insert the instruments at 0 degree, like you hugging the tooth with the terminal working end. Slide the instrument in at the 0 degree. Once you inserted the instrument underneath the gingival, you will engage the calculus and then open up the working end so that you can activate the instruments. Once you activate the instruments, the terminal shank now is actually parallel to the long axis of the incisor. Okay. To remove the calculus, you apply the vertical short stroke with a medium lateral motion. Continue the movement until you are able to remove all the subgingival calculus underneath the subgingival area. Now, I will show you how to remove the subgingival calculus from the mesial aspect of the posterior teeth. So, the Gracie to use is number 11, 12 for the mesial of the posterior regions. First of all, we will remove the calculus, subgingival calculus from the premolar. We need to make sure you have identified the correct cutting edge so that you can adapt the correct cutting edge along the tooth surface without injuring the gingival. We need to insert the instruments at a 0 degree, whereby you are hugging the tooth with your terminal working ends, like this. Okay. Try to insert the instrument securely underneath the subgingival area. Engage your subgingival calculus. Once you're able to engage the calculus, we will then need to activate the instruments by opening up the cutting edge until the terminal shank is at a parallel to the long axis. Once you achieve these activations, you can now remove the calculus with vertical short stroke, like this. Okay. If you want to repeat the stroke again, make sure you insert the instrument at 0 degree again. Open up the instruments at 60 to 70 degrees until the terminal shine parallel to the long axis of the premolar. Apply a vertical stroke at the medium to lateral pressure to remove the subgingival calculus. Repeat this until you are able to remove all the subgingival calculus. Same principle apply for the mesial of the molar. You need to insert the instrument at 0 degree like this. Slowly inside the subgingival region. After you are able to engage the subgingival calculus, you then opening up your cutting edge in which it is 60 to 70 degrees and also terminal shank parallel to the molar. Once you activated the instruments, you will now remove the calculus with vertical stroke, as shown just now. Repeat the movement until you are able to remove all the subgingival calculus at the mesial aspect of the posterior teeth. Now I will show you how to remove a subgingival calculus from the distal aspect of the posterior tooth. We will start with the removal of the subgingival calculus from the second premolar. First of all, you need to choose the correct graces, which is the 13 and 14 for the distal or posterior teeth. Once you have your instruments, then you will identify the correct cutting edge and hold your instruments with a modified plane grasp as mentioned just now with your stable finger rest. After that, you will insert the instruments at the 0 degree like we do for the other tooth surface. Once you get the instrument inserted and adapting the cutting edge onto the tooth surfaces, you engage the subgingival calculus properly. Then open up the cutting edge at 60 to 70 degrees until the terminal shank is parallel to the long axis of the premolars. Then activate your remover with a vertical strokes to remove the subgingival calculus. Okay. Repeat the movement by 0 degree insertions, opening up the cutting edge to activate the instruments. Remove the calculus with a vertical stroke. Repeat the motion until you are able to remove all the subgingival calculus on the distal aspect of the premolars. Now we move on to the molar. Same principle applies where you adapt the instruments and insert the instruments at 0 degree like you hugging the tooth on the distals of molars. After you insert the instruments without traumatizing the gums, activate the instruments by opening up the instruments at 60 to 70 degrees and make sure the long axis is always parallel to the molar. Once you engage the calculus, you will then make a vertical stroke to remove the subgingival calculus. Repeat the motions until you are able to remove all the subgingival calculus from the distal aspect of the molars. So now we'll move on to remove the subgingival calculus from the palatal aspect of the posterior teeth. So we will be using 11-12 to remove the calculus from the mesial aspect of the posterior teeth. I will show you on the second premolar now. First of all, same principle applies as you remove the buccal region. You need to insert the instruments at 0 degree as if you are hugging the tooth with the working end. Once you insert the instruments, you will find that you are able to engage the subgingival calculus nicely. After you engage the calculus, you then activate the instruments by opening up the cutting edge at the 60 to 70 degrees. And the terminal shank now is actually parallel to the premolars. Use vertical pull stroke to remove the subgingival calculus. Repeat the motions by 0 degree insertions, activate the instruments, and then vertical stroke to remove all the subgingival calculus from the mesial aspect of the premolars. Now, move on to the molar. We'll apply the same principle as just now. Insert the instrument at 0 degree, like you're hugging the molar tooth with your cutting edge. Once you insert the instruments nicely underneath the gingival, you can engage the subgingival calculus. Open up your cutting edge at 60 to 70 degrees until your terminal shank is parallel to the long axis of the molars. Remove the subgingival calculus with vertical pull stroke. Repeat the motions by 0-degree insertions and then activate your instruments to remove the subgingival calculus on the mesial aspect until you are able to remove all the subgingival calculus from the mesial aspect of the molars. Okay, now I will show you how to remove the subgingival calculus from the distal aspect of the palatal regions of a molar tooth. Same, we will use the 1314 to remove the subgingival calculus. First of all, same principle applies where you will insert the instrument at 0-degree as if you are hugging the molar tooth. Try to insert the instruments underneath the subgingival regions. Engage the calculus. Once you are able to engage the calculus, open up the cutting edge until your terminal shank is parallel to the molar. Remove the calculus with vertical stroke. Continue the movement until you are able to remove all the subgingival calculus on the distal palatal aspect of the molars.